Week after week, you, the viewers, allow us into your home on Video House Call to meet all the specialists and all the nurses and doctors, and we learn about their various branches of medicine. Well, tonight, I am very, very thrilled to tell you that our guest is someone who's already quite familiar to you, but we're going to learn a little bit more, and that is Dr. Dennis Gottfried. And in addition to a busy and active practice in internal medicine, he has also written a book, Too Much Medicine, A Doctor's Prescription for Better and More Affordable Healthcare, which is published by Paragon House. Welcome, Dr. Gottfried.
Thank you very much.
It's so unusual.
Very, very nice introduction.
Well, it's just so unusual to introduce you to your own show, but we are going to learn more about you tonight, and I get the pleasure of interviewing you. So I guess the first thing I want to ask is, as I said in the introduction, you do have a busy day job.
Yes.
You know, you treat thousands of patients a year in internal medicine, and what made you want to write a book, first of all, before we get to the actual book?
Right. Well, you're quite right. As a primary care doctor, I'm responsible for the care of 3,000 patients. Over my medical career, I've taken care of tens of thousands of patients. So I do have a first-hand, in-the-trenches type of experience in providing care for people. And I felt that from that perspective, I do have an awareness of the problems in healthcare and how to make healthcare better in America. Most of these books of this sort are written by people with different experience, insurance executives, academicians, doctors who are major medical centers who really don't have hands-on experience, investigational reporters, politicians. So I felt that I could provide a different perspective and hopefully help make things better.
Okay. I guess the first thing I should ask you is, as a doctor, as a practicing doctor, how are medical decisions made?
Well, I think that's key. I think people have to be aware how medical decisions are made in America. When a doctor or a healthcare practitioner, a physician's assistant, a nurse practitioner decides on what to do with a patient, what tests to order, what medications to prescribe, certain things weigh in that decision. First and foremost is what's the best care available. Doctors, nurse practitioners, physician's assistants went into the profession because they want to make people better. We like to have patients come back and say they feel better. So really what's the best care possible is the primary decider in a healthcare decision. But other less noble factors play a role also in healthcare decisions. There are financial incentives. Obviously doctors, hospitals, pharmaceutical companies, pharmacies, nursing homes, it's an entrepreneurial system, and people are in this to make a profit. So that this plays a role in every decision. It may not be totally conscious, but it plays, at least in the background. It helps decide what we're going to do as far as patient care. There's consumer demands. The patient comes to the physician. They have certain ideas of what they want done. They may have read it in a newspaper, they may have talked to their friends, they may have read something by advocacy groups like American Heart Association, American Cancer Society, they may have seen pharmaceutical companies' advertisements, they may have found out online, but they come in with an idea of what they want. And since we do run a business, we try to accommodate the consumer. And also there's a constant concern about malpractice. And it's a real concern. Half of all neurosurgeons in America are sued every year. 1/3 of all OBGYN doctors are sued. 1/3 of plastic surgeons, emergency room physicians, orthopedic surgeons, they're sued every year. For people like me, and I don't do high-risk type medicine, I do primary care, even for people like me, the concern of avoidance of malpractice weighs into every decision. So although we try to do things for the proper reasons, financial concerns, consumer demand, and avoidance of malpractice plays into every medical decisions, and it really detracts from the care and also increases the cost.
Okay, because I'm not a doctor, my follow-up question to you on that is going to be in terms of consumer demand.
Yes.
As a patient.
Yes.
How do you change that? How do you re-educate patients to think differently, to understand that not every test is necessary or best for them?
Well, part of that, I think, will be impart an educational process for the public to understand that even though they may see ads for physicians or hospitals or pharmaceutical companies, that this doesn't necessarily represent the best health care. I mean, I will, when people will come in and want a certain medication, I try to explain to them that the reason they saw the ad on TV or in the magazine was not necessarily because it was the best medicine, it was because the pharmaceutical company's making money off of it. But that extends to doctors and hospitals also. For instance, in the United States, the likelihood of having a cardiac catheterization does not depend on the incidence of heart disease in the area. It depends on the number of cardiac cath labs. Doctors create their own demand. When we have a surplus of physicians in a given area, more procedures are done, regardless of the incidence of disease. So if we look at the number of cardiac catheterization labs, where the more cardiac catheterization labs, the more cardiac catheterizations, more open heart surgery, regardless of heart disease. So this all has to be addressed with if we want to improve the quality of healthcare in America and yet decrease the cost.
Okay, and which goes along with one of the statistics in the book, which is
Yes.
that the World Health Organization ranks the United States as 34th in healthcare.
Well,
Is that correct?
there are different rating systems for the United States, but when we look at objective parameters of healthcare, infant mortality, life expectancy, in spite of our paying so much more than any other country in the world for healthcare, we rate relatively low. One survey from the World Health Organization rated us 72nd between Argentina and Bhutan in healthcare. Another one from the World Health Organization rated us, as you said, in the 30s. It might be argued that we have a large group of Americans who are uninsured, and this is why the statistics look so unfavorable. And that if you're going to get sick, America's the country to get sick in because we have the highest technology care. That's not valid. There's a statistic called death before age 75 that can be averted with medical care. In other words, Americans who get sick with cancer and heart disease, when compared to the other developed countries, of the 7 countries they looked at, we were dead last. Again, it might be argued that there's populations in America that don't have health care, but if you look at the top 10% of Americans, all of whom have health care, and compare them to the top 10% of people from England, and you look at objective parameters of health care, Americans do worse. It's do worse. And that's because we provide care for reasons other than what's the best for the patient.
So we've in essence created our own market.
Yes, we create our own market. The consumers want to do it, and if something goes wrong and we haven't accommodated the consumer, there's a constant risk of malpractice. And all those factors play a role in making care worse and more expensive.
Okay. Obviously, I have a whole list of questions in limited time. I could go on and on. Obviously, I'm a fan of the book. I think it's well documented. But I'm going to ask you one more closing question, and it's a little loaded. Is medicine today over-specialized in America? Is it too many specialists, and how does that hurt us?
An ideal healthcare system would consist of 30% specialists and 70% primary care doctors, internists, family practitioners, pediatricians. We need a threshold of specialists to provide optimal care. We are far in excess of that in America. We have 70% specialists, 30% primary care doctors. Each year that ratio gets worse and worse. More and more young physicians are attracted to specialization in America because of improved lifestyle, higher reimbursement schedules, more social prestige. The forces in American healthcare push towards specialization. We have residency and subspecialty training programs that are available out of proportion to our needs. And that's because for the major medical centers that have that, again, it provides prestige and revenue for those centers. So these are not the kind of motives we need to provide an optimal system for America. Yes, unless we address this, the problem is only going to get worse.
Okay, and I would like to say, unfortunately, we're out of time, but what I would like to say is the reason the book I find is so effective is that it's not a whine. It's not a whine. It does offer solutions to some of the problems. There is a cure for our ailing health system.
Yes, we have to be aware of the questions before we can get the proper answers.
Thank you. And again, the book, Too Much Medicine, A Doctor's Prescription for Better and More Affordable Healthcare, is available on Amazon.com. Thank you, Dr. Gottfried.
Thank you very much.